Pakistan remains one of the only two countries in the world where polio is still categorized as an endemic. In February 2022, Pakistan marked a full year with zero reported polio cases. Bill Gates hailed the development on his maiden visit to Islamabad and was even conferred with the second highest civil award by President Dr Arif Alvi for his philanthropic work to fight poverty and diseases, including polio. The fate, however, was short-lived because soon after, in April 2022, a 15-month-old boy was found paralyzed by wild poliovirus in North Waziristan. A total of 20 wild poliovirus cases were detected across Pakistan in 2022, while the number of positive environmental samples isolated increased to 37. Let's first break down what those terms and numbers mean.
These are three different serotypes of poliovirus. And the reason we say wild is because this is naturally, these are naturally found. So just like other diseases have also different serotypes, like dengue has different serotypes. Similarly, polio has also three serotypes, type 1, type 2, type 3. But type 2 and 3 have been declared eradicated since the last one was which was declared eradicated was 2015. So now there is only one wild poliovirus strain which is happening around the world, and that's wild poliovirus 1, and Pakistan is also infected with the same. The remaining are the last serotype of poliovirus. Three strains or three serotypes. Actually, the only difference is that type 1 is a little bit more virulent. And just to give you an example, that out of 200 people who are infected with poliovirus type 1, 1 in 200 people will get paralysis. While the polio 3 strain 3 was milder one, and it will inflict paralysis among 1 in out of 1,000 people who have been infected by wild poliovirus. Otherwise, they don't confirm cross immunity to each other, and so now, for all practical purposes, we are dealing with wild poliovirus 1 in Pakistan. Like whenever we talk about naturally occurring or wild poliovirus, that's type 1. As I said, that out of 200 people who probably have polio, we can only find out about one case, and that's why you need to remember that if you find one polio case, which is we find it because the kid has paralysis, flaccid paralysis. But the remaining 200 people are in the community, or 199 people are in community while they are infected by poliovirus, and they are excreting the poliovirus through their feces. And they can keep excreting that virus in their feces for up to many weeks, even though they may not have any major sign and symptoms themselves. So to understand the level of disease in a community, the sewerage samples are taken at different places, and they are tested for any signs of polio virus in the feces. And if there is a positive, you find a polio strain in the feces, that means in this community or in this population there is ongoing transmission of polio happening. And so that help us try to understand the level of polio in a community, even though, as I said, the people with actual paralysis will be very far and fewer, and on the basis of only them, it will be difficult to say that we have controlled polio transmission in that population.
In 2022, over 22 million children were administered anti-polio shots in Punjab, 10.2 million in Sindh, 7.46 million in Khyber Pakhtunkhwa, 2.6 million in Balochistan, and about 1.5 million in Islamabad, Gilgit-Baltistan, and Azad Jammu and Kashmir. Despite extensive anti-polio campaigns, Pakistan has been unable to eradicate polio. We asked National Coordinator of Pakistan's Polio Eradication Program, Dr. Shehzad Asif Beg, why.
Yes, we were so close to eradication in the beginning of the 2022. We had 15 months without any isolation of detection of case in Pakistan. But unfortunately, even at that time, we were continuously detecting virus in the environment in Bannu and DA Khan division. So, for polio eradication, it is not that you end polio cases. We have to eradicate polio virus from the world. So, although we were not reporting polio cases, we were still reporting polio virus only in that area. The rest of the Pakistan, even now, is polio free for more than 2 years. So, in those areas, because the virus was there, and unfortunately, there were the children's which were not fully protected. The quality of our polio campaigns in those areas was not good, and the vaccine acceptability in those areas by the people was also not good. We need to understand the South KPK, those 6 districts, 7 districts now, is an area which is bordering with the Afghanistan, lot of population movement. People have mistrust over the government. The people have low acceptability, low confidence on the efficacy of the vaccine. And they also believe that this is a program which is very dear and to government, and this is a best opportunity for them to get their demands met. So, in that difficult areas, when that virus circulated, it catch those unimmunized children, and we have a small outbreak. But luckily, that stayed in the same areas even up to now. There is no polio case out of that area. 17 cases from North Waziristan, 2 from Lucky Marwat, and 1 from South Waziristan. So yes, we were so close. We were unfortunate. We failed to finish the virus in its last hideout, and that is from there it re-emerged. But luckily, we are in control again.
The 2011 CIA operation that led to the US finding Osama bin Laden did much damage to the anti-polio drives in the country. The fears inflated over the years with distrust over the vaccine. But do the anti-vaxxer conspiracies still induce resistance? We asked the experts.
As a head of Pakistan polio program, I can categorically say that all these propaganda, all these rumors are wrong. The vaccine is safe. It doesn't have any of these elements. It does not have side effects. Even in Pakistan, it is in almost 40 years we are using. So the children which we used vaccine on 40 years ago, they are now in their middle age, and all of them are healthy and working very well. And this vaccine was in the other countries also. So, but having said that, you rightly said that these apprehensions, they are highest in these areas. So this is still a challenge in these areas.
2011 incident, even though it was not the polio vaccination campaign which was used, it was another disease, but still all the vaccination programs in conflict areas came under suspicion, and I think that was not a wise strategy for anyone to use a health system, especially the vaccination component, for any other purposes. And that put lives of doctors, nurses, paramedical staff, and the volunteers of polio vaccination at risk. Many young women had died just because they were giving polio vaccination to the kids. So that's the unfortunate part. But thinking about, that's the only reason that why Pakistan has not been able to eradicate polio. is not correct either. We have multiple reasons of why we are the only one of the last two countries which still have the polio virus, wild polio virus, and we need to look on this issue much more comprehensively instead of just blaming on one part or another part.
One of the major findings in polio situational reports was the locations. The outbreak would be traced back to southern Khyber Pakhtunkhwa, which coincidentally was also seeing an uptick in terrorism.
So obviously there is an indirect link between the security situation in Pakistan that is linked to the spread of the polio virus, and the same is in Afghanistan. If the security situation does not get better, the teams do not get access to polio drops and more of the children, and that is why it can cause a major outbreak in these localities as well as the rest of the country. With the escalation in violence, we also see the epidemiology of the virus in Pakistan changing. While the virus is concentrated in southern Khyber Pakhtunkhwa, and there were cases that were reported from North Waziristan and Lucky Marwat simultaneously, because areas become inaccessible due to security concerns and staff cannot reach those localities. The fear that the virus would spread from there even endangers the health of children in other parts of Pakistan, because these communities are transient. They are moving around consistently of the displacement patterns that we've seen in the last decade and a half. Whereas those areas such as North Waziristan and South Waziristan, residents of these localities are now settled in areas of Punjab and Sindh. If these children remain unimmunized and they are consistently in traveling, it poses a problem. The situation in Afghanistan matters a lot as well, because Pakistan and Afghanistan are considered to be one epidemiological block. So there is no direct link between the polio virus as well as terrorism is concerned. But obviously, the polio campaigns in the country are dependent upon the security situation. Considering the recent epidemiology, the areas where the virus is traveling are from all genetically linked and looped up with the southern parts of Khyber Pakhtunkhwa, the strip leading right from the Kohat tunnel till South Waziristan and North Waziristan. And we do know that these communities in these localities during the last couple of years, or probably the last decade, have been affected by military operations and have settled in areas of Karachi and Lahore. The security situation in these particular localities actually demand more of essential immunization coverage as well as supplementary immunization, which is the polio drops, for the outbreak to stop. The security situation, and considering the attacks in these areas, particularly attacks on police that escort these teams, have made it difficult to administer polio drops. Even as we are speaking, there is a held-up campaign in the Mahsood area, because South Waziristan is now divided into two different parts, Lower Waziristan and Upper Waziristan. And while the campaign in Lower Waziristan continues, but it has been halted in the areas of Upper Waziristan.
So, how does the government plan to handle the terror threats?
Unfortunately, whenever we are this close to polio eradications, there always the anti-polio propaganda also becomes highest. So there are forces, which maybe doesn't want the success of the government or the programs. What we can do, there are so many things which are not under our control, but I can tell you very categorically that the Prime Minister of Pakistan, the Health Minister, and Pakistan's armed forces and law enforcement agencies are fully cooperating with us. In Lucky Marwat, Tank, and some areas in DI Khans, even there are 8 policemen with 1 polio team, and there is not a single polio team which does not go without the police protections and the armed forces cordoning of the areas. So we are getting the best security, whatever the program can do. But we need to understand that if there are 20,000 teams in an area, of about 80,000 law enforcement agency personnels are involved in conducting that. So the chances of attack on any one team also increases, and that's what happens. That every campaign there is some sort of attacks on our security personnel or on our teams. But majority in cases it is on the security personnel protecting our team. We are trying our best. The government is trying our best. The morale of our frontline worker is very high, and we are determined to get this menace out of Pakistan.
Since Pakistan and Afghanistan remain the only two countries struggling with polio, is it possible for one country to eradicate polio without the other?
The Pakistan Polio Program and Afghanistan Polio Program, that means the Pakistan Polio Emergency Operation Center and Afghanistan Polio Emergency Operation Center, we work together in synergy. We regularly meet. We even plan to conduct our campaign at the same time so that the children at the both sides of the border are vaccinated at the same time. We have border crossings, and on both sides of the border, on the Afghanistan side as well as on the Pakistan sides, we have permanent teams stations there which are vaccinating not only children up to less than 5 years, but children up to 10 years at all the times. And in 2-3 border crossing point, we are doing all age vaccination. So in Pakistan and Afghanistan, all the places where there are possibilities of people crossing the borders, we have transit point. So we are working together. We are plugging those holes. And even if the people cross from Afghanistan to Pakistan, we make sure that we record their movement, and wherever they go and settle, we reach them. And so there is a very good synergy, coordination, and cooperation between the two programs. But at the end of the day, we have to do our part. These are the two countries only remaining, and the whole world is looking at it. The other thing is, we need to understand it is very embarrassing for the Pakistan that we are being clubbed with a country for being the last country to have polio, which doesn't have a strong government. They have their civil war and all those things, and we as a nation are in that category which have failed along with them. So that is also something we need to look into as a nation, that we must get this polio out of this country. And honestly speaking, geographically, when the Pakistan gets polio free, the chances of Afghanistan getting polio free will increase many folds.
The situation in Afghanistan matters a lot as well, because Pakistan and Afghanistan are considered to be one epidemiological block. So while they may be considered two different countries, but according to the epidemiology, the virus that is found in Afghanistan is found in Pakistan, and the same cluster goes vice versa. And the genetic sequencing actually proves that. So obviously there is an indirect link between the security situation in Pakistan that is linked to the spread of the polio virus, and the same is in Afghanistan. If the security situation does not get better, the teams do not get access to polio drops and more of the children, and that is why it can cause a major outbreak in these localities as well as the rest of the country.